Ceftizoxime, detailed drug information. 1. Generic name, drug class, brand name. Generic name, Ceftizoxime. Drug class, third-generation cephalosporin, β-lactam antibiotic, broad spectrum, bactericidal. Brand names, Cefizox, most common. Ceftizox, Azoxlif, regional variations. 2. Definition. Ceftizoxime is a semi-synthetic, broad-spectrum third-generation cephalosporin antibiotic. It is parenterally administered, IVIM, and used for treatment of moderate to severe infections caused by susceptible gram-negative and some gram-positive bacteria. It was developed to be resistant to many beta-lactamases, enzymes that inactivate penicillins, and early cephalosporins, making it more effective against resistant strains. Number 3. Mechanism of action. Ceftizoxime, like other beta-lactam antibiotics, works by inhibiting bacterial cell wall synthesis. Specifically, 1. It binds to penicillin-binding proteins, PBPs, inside the bacterial cell wall. 2. Prevents transpeptidation, cross-linking of peptidoglycan chains. 3. Weakens the bacterial cell wall, leads to osmotic instability. 4. Bacterial cell undergoes lysis and death. Bactericidal, kills bacteria, not just inhibits. Number 4. Uses ceftizoxime is useful in treating moderate to severe infections, especially when caused by gram-negative organisms. Respiratory tract infections, pneumonia, bronchitis, urinary tract infections, complicated or uncomplicated, intra-abdominal infections, peritonitis, abscess, gynecologic infections, endometritis, PID, gonorrhea, skin and soft tissue infections, bone and joint infections, septicemia, bloodstream infections, surgical prophylaxis. Number 5. Indications. FDA and clinically approved indications include lower respiratory tract infections, urinary tract infections, skin structure infections, intra-abdominal infections, gynecologic infections, endometritis, pelvic cellulitis, gonorrhea, single-dose therapy, bone and joint infections, septicemia, surgical prophylaxis. Number 6. Contraindications. Absolute hypersensitivity to ceftizoxime, other cephalosporins, or beta-lactam antibiotics, penicillins, carbapenems. Previous severe allergic reaction, e.g. anaphylaxis, to beta-lactams. Relative, use with caution. History of gastrointestinal disease, colitis, renal impairment, pregnancy, breastfeeding, use only if clearly needed. Before taking this medicine, precautions. Allergy history. Patients allergic to penicillin may also react to ceftizoxime, cross-sensitivity risk 5 to 10%. Renal impairment. Adjust dose to avoid accumulation and toxicity. History of GI disease, risk of Clostridium difficile colitis. Pregnancy. Category B, animal studies show no harm, but no well-controlled human studies. Lactation, small amounts excreted in breast milk, use caution. Long-term use may lead to fungal or bacterial superinfections. Liver disease, monitor liver enzymes if prolonged therapy. Number 8, how to use. Administered parenterally only, IV or IM, not absorbed orally. Reconstitute powder with sterile water or compatible IV solution. IM injection, deep into large muscle mass. IV injection, slow IV push or infusion. Always use aseptic technique. Number 9, dosing information. Adults, general, 1 to 2 IV IM every 8 to 12 hours. Severe infections, up to 2 grams every 6 to 8 hours. Gonorrhea, uncomplicated, 500 milligrams IM single dose. Surgical prophylaxis, 1 gram IV IM 30 to 60 min before surgery. Repeat if surgery prolonged. Pediatrics, 50 to 180 milligram kilo per day in divided doses every 6 to 8 hours. Severe infections, up to 200 milligram kilogram per day. Renal impairment, dose adjustment required when creatinine clearance, CRCL, 20 milliliters. Number 10, missed dose and overdose. Missed dose, take as soon as remembered. Skip if close to next dose. Do not double dose. Overdose, symptoms, seizures, encephalopathy, neuromuscular irritability, kidney toxicity. Treatment, supportive care, airway protection, seizure management. Hemodialysis may help remove drug from bloodstream. Number 11. Stop or avoid taking. Stop immediately if severe allergic reaction, rash, swelling, anaphylaxis, persistent diarrhea, possible C. difficile infection, signs of liver dysfunction, jaundice, dark urine, abnormal kidney function, decreased urine output. 12. Side effects common: pain, redness, or swelling at injection site, diarrhea, nausea, vomiting, rash, itching, urticaria. Less common but serious: hypersensitivity, anaphylaxis, Stevens-Johnson syndrome, Clostridium difficile associated diarrhea, pseudomembranous colitis, hematologic, anemia, leukopenia, thrombocytopenia, eosinophilia, Hepatic, elevated liver enzymes, hepatitis. Neurologic, seizures, especially with renal impairment, high doses. Superinfection, fungal or resistant bacterial overgrowth. Number 13, vital information. Complete the full course even if symptoms improve. Not effective against viral infections, e.g. flu, cold. Monitor renal and hepatic function in prolonged therapy. May cause false positive Coombs test or urinary glucose test. Report immediately. Persistent diarrhea, rash, jaundice, breathing difficulty. Drug interactions, other drugs that affect ceftizoxime. Aminoglycosides, gentamicin, amikacin, tobramycin, risk of kidney toxicity. Loop diuretics, furosemide, bumetanide, nephrotoxic potential. Probenecid, renal excretion, ceftizoxime serum levels. Anticoagulants, warfarin, heparin, bleeding risk due to vitamin K interference. Other antibiotics may antagonize effects if bacteriostatic, e.g. tetracyclines, chloramphenicol. Thank you. Have a nice day.